The following segment is sponsored by Northern Nevada Health System.
Welcome back to Family 411. We are here at Northern Nevada Health System with Kaytlyn Korn. You are the stroke coordinator here. Talk to us a little bit about what the signs are that somebody's having a stroke.
So we utilize the acronym F.A.S.T. So we use those letters to remind us of the symptoms of a stroke. So B stands for balance, which could be dizziness, it could be headache. We utilize eyes for the E. So E would be loss of vision, change in vision, blurred vision. So the F stands for face, so that would be facial drooping. We also have A for arms. So that could be arm or leg, and that would be weakness or unable to move that arm. We have S for speech, so that would be slurred speech, that would be jumbled speech. And then we've got T for time. Then that's really important because you want to call 911 and get help as soon as possible.
So before any of this happens, is there anything you can do to prevent a stroke?
So there's some things that we do have in our control that can help prevent a stroke. We can choose to have an active lifestyle and maintain a healthy weight. We can choose to eat healthy foods, and we can limit the amount of alcohol that we take. We can also choose not to smoke or use recreational drugs. We can also be proactive in our health. So we can maintain care with a primary care provider. We can also make sure that we are adhering to the medication regimen that our provider prescribes for us.
Okay. What type of therapy would somebody who has had a stroke be prescribed?
So a lot of times it's a lot of different departments that come together to really care and support for these patients. We use physical therapy, occupational therapy, speech therapy. We also utilize rehab programs. Patients are evaluated for rehab, and then we also offer, which is really neat, a stroke support group. So patients that have had a stroke can come together and just support each other on a more emotional and a community-based platform.
Who would you say is most at risk for developing a stroke?
Those that are at most risk for a stroke are those who have uncontrolled high blood pressure, diabetes, don't live an active lifestyle, or have overweight. We also are concerned about people who don't control these conditions. If they're uncontrolled, they're at much higher risk for having a stroke. And then those who've had a stroke already are at much higher risk for having another one.
Okay, good information. Thank you, Kaytlyn, so much. If you want to watch this again or you missed anything, we're going to have it all for you up on our website, foxreno.com.